Now, because of lot of junk foods and everything, we are seeing this in a very early school going girls also. They come with obesity, they come with irregular cycles, they have monthly cycles which they have also forgotten their last menstrual period. Please take care of your health, do your routine checkups, ultrasounds, mammographies and hemoglobin, and please, if you have any issues like any discharge per vaginum, do your routine pap smears. Most of the women don't know what is pap smear.
Hello everyone, I am Dr. Roshnee, your host, and I welcome you to the second episode of Season 1 of MSC Goa's The Podcast Show. After our first episode, we've received really great feedback from our viewers and fellow doctors. Thank you all for the support. Before we begin, here's a quick poll for the ladies. How many of you have been victimized by random period drama? So if your ovaries love chaos and your hormones miss the memo, then you are here at the right place, because today we will be discussing about PCOS, a condition faced by many women all over. Today's episode is sponsored by CREVEA. Thank you, CREVEA. CREVEA offers ready-to-make fruit smoothie mixes made with real fruits designed for everyday convenience. These fruit smoothie mixes are available in 3 different flavors: strawberry, mango pineapple and tropical pina colada. With CREVEA, you can make delicious, healthy, hassle-free drinks at home within few minutes. You can order these products from Amazon. We have put down the link in the description below. Moving on, to share her expert insights, we have a lovely guest with us today. She is an obstetrician and gynecologist who deeply cares about women's health. Beyond hospital, she is also a doting wife and a proud mother to a toddler. She also loves cooking and she is a fitness enthusiast as well. She has been awarded the best performing gynecologist by the State Family Welfare Bureau in 2024. After finishing her PG, she worked as an SR and thereafter consultant in GMC. She has her own private practice at Porvorim and Panjim. So presenting before you, Dr. Nisha Naik. I welcome you, ma'am, to the second episode of the MSC Goa's podcast show.
Thank you, Roshnee, for the lovely introduction, and thank you, Team MSC, for inviting me over for this lovely talk on PCOS.
Ma'am, I'm sure everybody is very eager and waiting to know about PCOS from you. So let's start with the basics. Yes. What exactly is PCOS?
So polycystic ovarian syndrome, as the full form of PCOS, it's a hormonal disorder, okay, in which what happens is there is an ovulation, okay. So there is no ovulation for a long time. So patients present with different symptoms, like most commonly being hormonal imbalance leads to menstrual irregularities. They have hair in not so normal places, which are common for females, okay, and they can also present to you with acne and other symptoms like weight gain which has happened drastically over a few months.
So how common is PCOS?
So at least in my OPD, I see 1 in 5 women come with polycystic ovarian syndrome, and it's a disease of, actually it's not a disease, it's a hormonal imbalance which is mostly seen in the reproductive age group from 18 to 35. But now, because of lot of junk foods and everything, we are seeing this in a very early school going girls also. They come with obesity, they come with irregular cycles, they have monthly cycles which they have also forgotten their last menstrual period. 2 months they don't get, 6 months they don't get. That is all because our lifestyle has changed. The exercise what they have reduced, they are sedentary, they are only on their phones. So as we see the disorders which are common like diabetes and all, which we used to see at the age of 40-45, are coming early on even in these females.
Okay. Ma'am, what symptoms should women look out for? If they have PCOS, then what are the common symptoms they might come across?
Yeah. So what happens is the woman in this age group, they come most common with the menstrual complaints that they are not having regular periods. They don't get their menses on time. Okay, they will come with a history of amenorrhea for like 3 months, 4 months, 6 months. They may come with weight gain. They may come with acne, hormonal symptoms, and also with hair over their chins, excessive hair loss. So these people may not always present to obstetrician and gynecologist. They may also go to a skin specialist. So it is very important for us to diagnose them early on and refer to gynac or skin for their respective complaints.
Got it. Yeah.
And also, since this happens in the school going girls and the reproductive age group, once they are married, they fail to conceive naturally. So that is also another time that they come to gynac first. So they will come to us that they want to conceive, and then they are diagnosed with polycystic ovarian syndrome.
Yes. Okay. Having said about infertility, does PCOS always cause infertility?
No. See, people with polycystic ovarian syndrome can conceive naturally if they come to a gynecologist early on and their complaints are sorted before. Like, we will make their periods regular, we will track their ovulation, and we can give them medicines so that they ovulate, and we can help them conceive naturally.
Ma'am, many people think that PCOS is only about cysts in the ovary. Is it true, or how would you like to shed some light on this topic?
Yes. So this polycystic ovarian syndrome is a hormonal disorder in which what happens is it involves a lot of metabolic components. Okay, so what happens in this, there is male hormones increases. Okay, so females have estrogen and progesterone as the female hormone, and males have more of the testosterone as the male hormone. So what happens in this, because of hormonal imbalance, the insulin resistance happens. Okay, so what happens, every female is born with a fixed number of ovaries, fixed number of follicles in their ovaries. Okay, so in this what happens, the females, since they don't get ovulation every monthly, the ovum doesn't rupture and come out into the tube and the uterus to cause menses. So they keep forming small follicles in the ovaries. Okay, so this is shown as polycystic ovaries. So they are not cysts, they are basically the ovum which has not ruptured and formed a not ruptured and gone into the tube and the uterus. Okay, so this is seen as polycystic ovaries. So this leads to anovulation. So anovulation, what happens, because of anovulation, the male hormones in the female increases. So that's why they get the male pattern hair. Okay, so that is the reason the male hormone increase. So they start losing the hair and they'll get hair over their chin areas, then they'll have hair over their beard areas. Okay, so that happens. Then this insulin resistance also increases a lot of androgens in the body. Okay, so what happens is, because of this, their belly fat increases. So they start becoming obese. Okay, they will become fat, and it is very difficult for them to lose this weight. Also, this hormonal imbalance can further on, if not treated on time, will lead for them to have other systemic disorders like diabetes, hypertension, anxiety, depression, all this, even heart disorders. Okay.
Yes, you have explained us about many clinical features, but also like how is PCOS diagnosed? Is there anything else you would like to add on that?
Yeah. So we don't need an ultrasound for diagnosis of polycystic ovarian syndrome. As I said, they may not come to the obstetrician first. They will go to the weird symptoms like hair loss. This is the most common symptom any patient goes to a dermatologist for. So the dermatologist may be the first person to diagnose that the patient is having polycystic ovarian syndrome. Okay. Then once you ask them about their menstrual complaints, they will tell you ki I don't get menses on time, I'm having hair this all over. They will come with shaved things. So you may not know unless you ask them, or they will go to acne to the dermatologist. So they are the first people, maybe they will diagnose, or maybe they will come to us with the menstrual irregularities. Okay, so they will come to us with menstrual irregularities. So that is the time we might do an ultrasound, and we will do a hormonal test in which the LH will be higher than the FSH. Okay, then the male hormone may be higher. Anovulation with this ultrasound features and the hormonal imbalance will itself lead us to diagnosis of polycystic. So, only based on ultrasound we may not be able to tell them that they are polycystic. Understood, no?
Yes.
So, this cyst is a misnomer. They don't have cysts. They are just the follicles which have not ruptured on time and leading to increase in the ovarian volume and the feature of multiple cysts. Okay.
Yes. So, is PCOS curable?
Yeah. So, what happens is polycystic ovarian syndrome. It is not definitely curable, but with proper treatment on time, like lifestyle modification, your dietary changes, and if required hormonal treatment, you can get it under control. So, what happens is even 5 to 10% of weight loss in the woman can lead to massive changes in the female body. So, what happens is a woman who is obese, who has polycystic ovarian syndrome. So, there are two types of polycystic ovarian. One is lean PCOS and one is obese. What we see mostly are obese PCOS. So, why they come? Because of fat shaming in the school and everything. So, they will come with, we have a lot of difficulty in losing weight, we have menstrual complaints and everything. Okay. So, I tell them at least 5 to 10% of weight loss. If you do, their menstrual complaints improve. They start having regular menses, their acne start improving, okay, their hair loss will improve. That why it happens, as you exercise and move your body, the blood flow to the ovaries increases, your insulin resistance, which leads to your increase in male hormones, also improves. So, it is increasing the insulin sensitivity. To decrease the resistance, we increase the insulin sensitivity by doing exercise. Increase in blood flow to the ovaries. Okay. So, lifestyle modification, decreasing in the junk food that you eat, the pizza and the burger with lot of cheese. I am sure the school kids are going with the tiffin of burger or cheese and pizza and all this only. Okay. So, what happens is they are only on this. They don't have any fiber, they don't have any protein in the diet. So, they have these preservatives which cause a lot of hormonal imbalance. Also, a consumption of lot of red meat has given rise to this increasing incidence of polycystic ovarian syndrome in younger age group.
Are there any long-term health risks of PCOS?
Yes. So, what happens is these young girls, as I told you, they come to me with these complaints. And also other women who come to me are the people who want to conceive. So, they have never gone to a doctor ever. Now, they are married and they want to conceive and they have come to me and diagnosed with polycystic ovarian syndrome. So, what happens is this infertility is a major issue nowadays. With all women, we have seen infertility in women even in the age group of 20s. Okay. So, that is because of all these things. So, what happens is we have to try to inculcate a lot of healthy habits, exercise into our routines, as this polycystic ovarian syndrome over time will lead to obesity and complications like diabetes. Uncontrolled diabetes can lead to retinal damage, kidney functions will get altered. This, because of this polycystic, they are not getting menses on time, they will get anxiety, depression, hypertension, lot of other metabolic disorders.
Comorbidities.
Yes, comorbidities.
Apart from general public, many NEET PG and NEET UG aspirants also watch our podcast.
Yes.
So, would you like to give them some advice, as like they would like to know more information as a specialist point of view?
Yes.
Okay.
So, now actually all my interns and whoever are juniors to me, they have always been asking me, ki, should we take OBG as our specialty? Because now all the young doctors only are thinking, not only, maybe their main priority is work-life balance. Okay, so work-life balance is never not achievable. It is a little difficult in a branch like obstetrics because we have emergencies. Okay, so we can you never know which patient will go in labor at what point of time. Not like they will complete 9 months and then 9 months they'll go in labor. they may go in preterm labor, they may have other complications also. So work-life balance is, I'm not saying not achievable, but you have to plan accordingly. Prioritize what you want to do. Prioritize whether you want this life. It is very difficult. I'm not saying it is easy. You have to have that brave heart to to take OBG.
As a consultant now, what advice would you like to give to your OBGYN PG students?
Yes, if you want to take it, you have to take it. And first year is little difficult. PG life is exhausting, difficult. You will be sad, you will be crying, you will be thinking why you have taken it, but it is really rewarding. At the end, you have to think 10 years down the line, would I want to be the person that I'm thinking of now, or do I want to change my career now on? So I feel internship is the right time for you to know which branch you want. So work like a resident in your internship. Okay, just think about what are the pros and cons of this branch, what are the pros and cons of this branch. I'm not saying you will get everything in OBG. Same way in other branches, there is something or the other you will miss, but that is what is life is. It is ups and downs. So you have to just take the good thing about OBG. The best part is that only being a OBG, you will still have patients. Okay. So you can decide what you want to do. So now there are super specializations coming in OBG like fetal medicine, laparoscopy, IVF, then oncology. So if you want a little less hectic life, maybe you can choose what you want to do. Just be a laparoscopic surgeon for gynecological things, or just practice obstetrics, or just do oncology in gynec, or just do fetal medicine where they only do type 2 ultrasounds to diagnose anomalies and do amniocentesis and everything. So there is little less emergencies in those things, as in if you only want to do obstetrics. Obstetrics is only about antenatal patients, see them, deliver them, emergencies are there. Okay, as compared to you go in these fields that you want to only do laparoscopic surgeries for gynec cases like fibroids or cysts or anything, or only do IVF. So people who are infertile, you only see them, manage them, make them conceive, and then stop your work thereon. Okay, or only see malignancies like cancer of the cervix, cancer of the ovary, cancer of the uterus, and manage them. So you won't have emergencies where you have to get up in the middle of the night and go. But if you want to practice obstetrics, be sure that your night routine, everything is gone. So you can be woken up at 1 a.m, maybe at 2 a.m, 3 a.m, and 4 a.m you sleep and still wake up at 8 a.m and go as if nothing has happened at night. Okay.
Ma'am, we know that how busy you are. You just said gynecologists and obstetricians can be woken up at any point of time. You also are a proud mom to a toddler.
Yes.
I've heard you love cooking and you also work towards your fitness. So how do you manage all of these things?
So what happens is planning is key, what I told you. So you have to plan well, just plan your day well. Okay, delegate work. This is what I learned after becoming a mom. So what happens once you get a child, you feel that you are the mom, you have to do everything, you have to change the diaper, you have to see the clothes, you have to feed the baby. No, if you go to do that, you will sideline your professional life. So what you have to do is delegate work whenever you can. So delegate your housework to a maid who will do cleaning, someone else who will do cooking, someone else to take care of your child while you go and see your other goals like your fitness, your cooking, your professional life, because all this is important. I will tell you one incident that happened. We had gone to a trip, okay, to Thailand, okay, with my 1.5-year-old son. So long international airports are like forever you have to walk. My son can't walk. I had to hold him and go. But I also couldn't walk with him, okay, because I was so obese after my delivery. So I can't walk with him. So this made me realize that fitness is so important. Who is going to take care of my son if I am not able to walk with him? That made me join gym. Okay, so I have been consistently going whenever I can, even if it is like, okay, 15 minutes, like 40 minutes I'll do, come back. And also you should have a supportive family who will take care of your children or your other things while you do, like your husband or your parents, your in-laws, and your son also. He has to also know my mom is doing this. So now he realizes that my mom is a doctor and she has to go for work and she'll come back when my time comes.
Sweet. What perception of yours, how your perception has changed like after becoming mother towards your profession?
Yeah, so as you know, you have done internship in GMC. It is chaos in labor room. So we obstetricians have a loud voice. Okay, so it is the truth that sometimes we are easily triggered and we shout. That has made me, after becoming a mother, little calm down and empathetic towards my patients, since I know I have gone through it, and I have become calmer and little more patient. And this is what even my other juniors and my colleagues have told me, that I am a little calmer, I don't get angry soon, and empathetic towards the patient, because what I have gone through, I know that they are going through.
So now it's time to put the formal discussion on pause for some time, because we have reached our fun segment.
Okay,
and it's the rapid fire round. So no thinking, no filter, just rapid fire. Okay, are you ready, ma'am?
Yes, Roshnee.
Most uncomfortable question patients hesitate to ask?
About sexual health. They don't want to tell about how frequent is their intercourse. If you ask them if they've come to you with fertility issues, or how many partners they have, and they don't want to show down, thinking that, oh God, what the doctor will think, whether I've shaved or not shaved, and little this, but we are not bothered about all that.
Next, one common habit to avoid during pregnancy?
Googling everything and diagnosing self. Oh, this fetal heart is there, am I doing the right thing, and all this. Just go to the obstetrician that you trust. Don't Google things.
Okay. Pregnancy myth you hear most often?
Eating for two. So since they have been told that they are pregnant, you have to have a child, so you eat for two people. So they will just gulp down everything and become like 20 kgs more than what they were. So eating for two is a myth. You only have to eat how much you are told to eat, a balanced diet.
Yes. Next, one word to describe your first year PG?
Exhausting.
If not OBGYN, which other branch it would have been?
Maybe pediatrics. Yeah, because maybe related.
One thing that you feel should change in OBS-GYN?
Maybe change as in, maybe we should consider the first years more, should allow them to sleep and eat, which has not happened with me. So I am little more, you should, they are also humans. Yeah.
The counseling is going on, and these people will really be happy when you're saying this.
Yeah.
So doctor's choice, normal delivery or elective C-section?
Normal if medically possible. If not, we should always aim for a healthy baby and healthy mother. So don't hesitate if your doctor is telling you go for cesarean. Maybe the doctor has more experience about it. That is why.
So you are wonderful.
Thank you.
What message you would like to give to women listening to this podcast?
So, to all women, please take care of your health. So most of my women who come to me only come to me when they are pregnant, or they want to become pregnant, or they have been bleeding so much that it has exhausted them that they cannot do their routine work, then they come. Please take care of your health. Do your routine checkups, ultrasounds, mammographies, and hemoglobin. And please, if you have any issues like any discharge, per vaginum. Do your routine pap smears. Most of the women don't know what is pap smear. They come to us in the last stage of their malignancy. So it is very sad to see that people, even educated people, don't know what is pap smear. Like, it is a basic test which does not even require anesthesia. It's a routine OPD procedure which can help us diagnose in like the very preventable disease, which is the second most common cause of death in India, CA cervix. So I feel very sad that people are not aware. So make anything happens, you please come to the respective doctor. Any doctor you go to, at least they will send you to go to this dermatologist, surgeon or gynecologist or anyone. Don't take your health for granted. Just don't become a mother or a housewife or a wife or only your professional life. Just balance your work, life, everything. Think about your health, go for your exercise, cook your meals, go for your holiday with your girls or your friends, whoever you want. Take care, go on dates with your partner or anyone, your partner, and just enjoy life and think that we have only one life. So we have to take care of our own body. Our body is our responsibility and nobody else's.
That was really nice.
Thank you.
One last thing I would like to ask you, like even in today's world, when everything is out there on social media or on internet platforms, so like do you still come across any stigmas regarding their reproductive health or sexual health? Your patients come with social stigmas.
Yeah. Yes, they do come, especially infertility. They come that मेरी they say in Hindi, मेरी भाभी है, उसको बच्चा हो गया है, शादी तो 2 महीने पहले, नॉट बच्चा हो गया, शी इज़ बिकम प्रेग्नेंट, शादी तो 2 महीने पहले हुए, मेरा क्यों नहीं हो रहा है. सो आई एम गेटिंग अ लॉट ऑफ टॉन्ट्स कि माई हस्बैंड विल लीव मी, माई इन लॉज आर टॉन्टिंग मी, अब्यूजिंग मी, so please help me. So they have come in the desperate thinking, you do something for me to conceive. That stigma that you are not able to give a child to the family is only on the woman. The woman bears it. So that is not the right thing. The baby is born by the female partner as well as the male partner. So it is not only on the woman. Also, when they give birth to a female, it is only that the female is giving birth to a female. It is not so. It is actually the male partner who is responsible for giving birth to a male or a female. This till date people are not aware, and they become sad कि अब तो मैं इस लड़की को घर लेके कैसे जाऊँ, अब तो मुझे मेरे पति छोड़ देंगे, and this it is very sad state of aware. We have to like come out of it, and we have to create awareness, I feel, about this thing, because people, the women are suffering in silence and their tears are only there in front of the doctor or in their room maybe. No one else sees it. It's very sad state of affairs.
So with that, we wind up our today's episode.
Okay.
Thank you, ma'am. I'm sure everyone has enjoyed it, and thank you for such an insightful conversation.
Yeah, thank you, Roshnee, for having me over.
Ma'am, we would like to present you with a small gift hamper from the sponsors of today's episode, CREVEA.
Thank you. That is so sweet of you, Roshnee and Team MSC.
Hope you guys enjoyed this episode, and we will be back with another guest in the next episode. Until then, have a great day.
You'll show me my things.
Yeah. I'll just take few shots of this.
Okay.
Yeah.
Like holding,
No,
we sitting only.
मध्ये मध्ये फंबल भी झाल्या.
While just taking close-ups of the